My name is Lawrence Pepler, and I'm the Senior Client Success Manager here at ChiroTouch Practice Management Software and Integrated Practice Solutions, and I am fortunate enough to be here to MC today's ChiroTouch slash KMC University partnered webinar on billing and coding hints and tips. My partners today are one of our senior trainers over at ChiroTouch. Her name is Michelle Butler. Michelle, good morning to you.
Good morning.
And then we are both blessed to be joined not by Kathy today, but by one of Kathy's, I would say, I don't know, chief lieutenants. Maybe that's inaccurate. Maybe it's accurate. Someone who's brilliant in her field, and that is Rebecca Scott. Rebecca, how are you today?
Good afternoon. I'm doing wonderful. Thank you.
Here comes a slide that tells us all about Rebecca. So how long have you been doing this, Rebecca?
So I have been in chiropractic since 1989, so for a very long time. Yeah.
That is awesome. And tell us about your certifications.
Yes, absolutely. So I'm a certified professional coder, so a CPC, a certified professional compliance officer, and then we're going to put a comma there and we're going to do CPB, which is a certified professional biller as well.
So, and folks, hey, right there next to Rebecca's smiling face, you're going to see all the information that you might want to have at some point in time if you don't already, which is going to link you through to KMC University, the by far the most knowledgeable and helpful billing and coding professionals in our industry out there helping chiropractors and folks of the ilk for over 40 years now, right? Today, what we're going to cover: why the patient intake process is the pointy end of the spear. How to ensure how you know all the rules for every payer you work with, and why verification is critical and not always only online verification. And then we'll open up the floor. So, Rebecca, I'm gonna shift things over to you.
All right. Well, thank you so very much. So today, like Lauren said, we're going to be talking about why the patient intake process is so important. We want to know how to ensure that we know all of the rules for every payer that we work with. It's so important to know the rules. It's hard to follow if we don't know what the rules are. And why verification is critical. And sometimes it's so hard to actually talk to a live person, but sometimes it is super important that we can't always just rely on that online verification. So let's jump right in. This is a data collection. So the list of items needed prior to the new patient arriving will vary, right, from clinic to clinic. Some of the items you need to collect prior to final entry into that practice management software like ChiroTouch might be the intake forms, copies of insurance cards or scanned images of the insurance card, a verification form, some outcome assessments, consent forms, the consent to treat and the minor consent form, of course, the office financial policy, our notice of privacy practices, an authorization to disclose PHI, and we might need to get that pre-certification or pre-auth. So just complying all of those forms that we need. So what do we need to know? And what would we like to know? And what would be awesome to know? So once you've established your scheduling process, you may think, good, all I have to do is book the appointment. Unfortunately, those were the good old days, to answer the phone and book the patient, ask questions later. That is unfortunately no longer possible. Now a clinic must develop a compliant intake process that requires the chiropractic assistant to gather important data from the initial phone call. So on this slide, you will see a list of need to know items. We need to know the patient's first and last name spelled correctly, would be great. We need to know what type of problem they're having. Where is it? We need to know the insurance or if they're using a self-pay. And why do you think that's important? Because we have new rules that we have to find out. And of course, date of birth, address, email, phone, and insurance details. So on that initial phone call, we need to ask, are you enrolled in a group health plan and will you be utilizing their insurance for the visit? And if they say no, would you need to offer a good faith estimate? So in most clinics, the staff is wearing multiple hats. We have all taken that call, and after hanging up, we realize, oh, I forgot to ask them something. In the past, that might just be a small hiccup in the scheduling process. Now, with the No Surprise Act regulations on the good faith estimates, we have to be sure we are asking the right questions and providing the information the consumer, or as we know them, the patient, information they deserve. So this is our KMC University's new patient data collection form, and you guys are going to be getting that at the end of our call today. It will be one of the goodies that we give you. And you can see right here, we ask them, do you have some kind of insurance you'd like us to assist in filing for you? I love asking that question because right off the bat is telling the patient, I'm doing this for you. I'm going to assist you if you have it. And it triggers the chiropractic assistant, if they say no, to offer the good faith estimate. So before collecting the insurance information before the patient arrives will allow us to verify the patient's benefit. This form also asks, like I said, if the patient does not have insurance, if they have the good faith estimate. So what happens if the patient says, oh, yeah, I'd love to have a good faith estimate? Okay, here we go. The government has an 8-page good faith estimate that you can utilize or customize. This is the KMC University 1-page document recreated for chiropractors. Whichever you choose, it must have the language recommended by the No Surprises Act rule. So don't just download a template and without checking for the required disclaimer language. So we really just want to make sure that we have all of the information that's regulated. If you have a typical new patient visit protocol, you can pre-fill this portion out and make a master template that could be tweaked if necessary. For the initial visit, it is difficult to provide detailed services since we do not know much about the patient. So things like diagnosis codes are optional at this point. And we don't want to list every service imaginable, only what you would perform on a typical initial visit. A good faith estimate must be specific for each patient. So it's not just a price list. It's not just your charge master that has all of your charges in there. Another option is to provide a price range for a typical evaluation, such as shown here. Depending on when the appointment is made, a clinic must abide by the delivery timeline outlined in the rule. If the appointment is made 3 to 9 business days in advance, the good faith estimate must be provided in writing to the patient within 1 business day. Normally that would be via the email, right? Because we can't really mail it to them within the day if requested by the patient. If they request one without an appointment, you have 3 business days to provide. So building the questions into your data collection phone process is important, but making sure your team keeps up with the deadline to respond is equally important. So in that initial phone call, what are some of the impacts that we need? We need to identify if the patients are insured or if they're self-pay. If they are insured, do they plan on utilizing their insurance by filing a claim? Does the patient want a good faith estimate? And that's something I really would love to just really bring home is we just have to offer the good faith estimate. Or is the patient just shopping around? And if the patient is just shopping around and they want a good faith estimate, we do need to still give that to them. So now let's switch gears. They're not self-pay anymore. They have insurance. So why is it important to have a process for insurance verification? That's a great question. So we want to confirm the patient's eligibility and the method of their coverage. We need to determine what the patient's responsibility is, and it helps us clarify covered codes and determine if there are any specific requirements or exclusions. The benefits. Too numerous to list here, but here are just some of the top 3. It decreases costly denials. It increases awareness in payer policy. And patients who understand their insurance coverage are more likely to follow through. Having a verification form will allow the clinic to ask all the necessary questions when you are speaking with the insurance representative. So this is just a sample. And here's one of my favorite softwares this is where in ChiroTouch, we can make sure that we're putting all of the accurate information. So in order for the chart entry process to be efficient, accurate, and complete, it is important to create a process for checking that all the information is valid, accurate, and included from the very beginning. Garbage in, garbage out. We don't want any claims disruption, that's for sure. So now let's talk about those payer relationships. So consumer empowerment has led to patients having the right to be informed of their out-of-pocket cost. As providers, it is vital that the clinic be prepared to meet these expectations of notification or keeping the patient in the know. In some cases, even out-of-network providers are required to notify the patient of their cost. The only way to navigate these waters is by taking advantage of the online resources. So hopefully everyone knows what an MRP is, that medical review policy. So here's just a nice little support tool that we have on the commercial insurance claims and the medical review policy. So medical review policies are plan documents used to support coverage decisions for specific healthcare procedures. Medical policies frequently address medical necessity or those investigational status based on contract definitions. So with our online portals, what can we find? So here's an example of an Anthem. And if we go to Anthem in your state, find the providers, we go to the provider resources, we can find our policy and guidelines. We can find those forms or guides if we have to do a pre-cert, if we have to credential a new doctor that's coming in, if there's some claim submission rules, and of course, if we have to do the dreaded provider appeal. This is just some of the information that's on those portals. And of course, we need to know what the fee schedule is. Knowing what the fee schedule will also help keep our patient ledgers clean. And I know Michelle's going to show us at some point after my presentation how to make sure that we are assigning those fee schedules to the patients so that it will automatically write off the difference between your actual charge and the allowed amount. So it's wonderful. So again, you can see on this Blue Cross Blue Shield of Illinois, you can actually submit a request form via the portal to get your fee schedule if you're not sure what it is. Now let's talk about some coverage details. So with this medical review policy, this is where we can find out what's covered. So keep in mind that payers will differ on covered services. If providing a service, do not assume if it's covered by one payer, it will be covered by all. On this slide, you see a carrier who has listed a few items that are non-covered. They're considered experimental or investigational. On the left, you see a long list of non-covered services for Aetna. As a major payer, Aetna has made it very clear that active release technique, or ART, is not payable. Now, Aetna's list used to go to the letter X, but it appears now they've added a bunch of letters to the alphabet to fit into their long list of those non-covered techniques or services. This is obviously growing. And if we are providing one of those services to an insured patient that's non-covered or experimental, we'll want to make sure we document and that the patient is aware. And again, not all payers are alike. This is an example of Blue Cross and Blue Shield. Notice they recommend the modifier 59 be appended when rendering a 98940 to 98943 when rendering at the same time as 97140. So even when rendering a 98943, the extra spinal at the same time, it is allowed as long as modifier 59 is appended to the procedure that was being performed in a separate anatomic region. Now, let's look at Optum's most recent policy. CPT code 97140 may not be billed on the same data service as an extra spinal, CMT, when the manual therapy is provided to any extra spinal body region or area. Wow, that means even if performed in another area, as required by CPT use of the 59, they will not pay the claim. So that's why it's super, super important to know what your payer guidelines are and knowing what that medical review policy is. So heads up, healthcare reform. So you may be thinking, why verify commercial plans, especially if you're familiar with the payer? Benefit level and exclusions may surprise us depending on the type of plan, such as self-funded or those ASOs or marketplace plans. Some feel there is no reason to ask about pre-existing conditions because of the Affordable Care Act did away with the pre-existing conditions in all insurance plans. This, unfortunately, is not so with grandfathered plans. Also, a patient may not have paid their premiums and the coverage was terminated, but it may take up to 60 or more days to show up in a quick eligibility check. So now let's turn to Medicare, one of my favorites. Why verify Medicare? Surely we can skip over Medicare. Sadly, no. There are too many layers of possible coverage to ignore. One misstep can derail all of our billing. So, traditional Medicare card. Starting with the traditional Medicare card, so those are for 65 years or older, but can also be someone who is disabled, not just for elderly, based on insurance status. From this point forward, the patient has many choices, and their choices impact the clinic's billing process. So they could use their traditional Medicare for all of their healthcare needs and nothing else. Wouldn't that be nice? We know that Medicare Part B covers 80% of the covered services, and the patient is responsible for the 20% plus their deductible. Or the second option is they use their traditional Medicare plan and purchase additional coverage with a supplemental plan. As we can see on this slide, it says AARP Medicare supplement plans. So that's something to really look for when a patient is giving you their insurance cards, especially with the United Healthcare now has the dual complete. So the AARP Medicare supplement plan can look very similar to the Part C plan. And my favorite part in the intake process. How many people have this? Patient comes in for their new patient visit and they hand you a bunch of cards and expect you to make heads or tails of it. Isn't that the truth? So another option, like I said, is the patient may opt out of traditional Medicare and join a Medicare Advantage plan or the Part C. And sometimes the patient isn't even aware that they signed up for it. So here's a sample of that other card where I had said, where it says AARP Medicare Advantage versus that Medicare supplement. So super confusing sometimes when they look very similar. So not all Medicare Advantage cards are easy to read. And some plans have limitations that can impact your billing process, especially plans that are those private fee for services or PFFS plans. It's really making sure we verify. So tools you need. Obviously, we need a verification form so that we know which questions to ask. Access those online payer websites and locate those summary benefits or coverage. And the medical review policy is super, super important. One verification form does not work for every type of insurance. So we have one for major medical, we have one for Medicare, personal injury, Medicare Advantage, Medicare as a secondary, workers' compensation, all require you to ask different questions. So what is the process? So one, really making sure we have a new patient data collection where we get all of the information we need. We have the demographics, we have the insurance information. We do an eligibility check. We confirm that the card is valid. If the patient is a self-pay or is not utilizing their insurance, asking or offering them the good faith estimate. And if they say yes, making sure we give it to them. Verification. So we're identifying and confirming coverage services, finding out what those limitations are, those exclusions, and what the patient responsibility is. Making sure that not only the CA, but the doctor understands what the medical review policy is, having a solid financial policy, and doing that financial report of findings so that the patient is aware of what their out-of-pocket services are going to be. Here is another tool that I use on a daily. It's the Carrier and Verification Reference Tool. This is a great little tool that we have that you'll also be getting at the end of today's presentation. That's a 3-page that has a place where you can put all of the clinic's information all in one place. It has who your MAC is. It has their website. It has their portal for login. You'll know what your provider's PTAN number is and their NPIs. So super, super important. So with our medical review policy, verification form equals success. Yay! And I love success. So here you go. Take out your phones and scan the code. This is where you can get your free downloads. And it's that new patient data collection form and the payer and carrier verification forms, which is super, super great. Is there any questions for me as I wait for a few minutes before I put the next slide up?
So far, no questions.
Okay.
We do have some gratitude thrown your way. Thank you for the slides. I did not realize the GFE had time limits.
Yes.
Kazara has a question. Can it be HIPAA compliant to have a VA complete insurance verifications? Or it's probably a CA, she means.
Oh, a CA. Oh, of course a CA can do the verification.
Yeah.
Or yes, he or she can definitely do a verification. Mm-hmm.
Yeah. And then Kathleen asks, what is the plan?
PTAN.
Oh, PTAN.
Oh, PTAN. I'm so sorry. Yeah.
Like, what's the plan? What's the plan, Stan?
Where are we going from here?
Where are we going?
Thank you, Michelle. Thank you, Michelle.
Oh, so it's a Medicare number, provider transaction something.
Access number.
Access number. Yes.
Yes.
Thank you.
Here we go.
Okay, I'm going to just go to our next slide. So this is super, super important. This is going to be great. We have a special going on in the library. It's exclusive for our friends at ChiroTouch. So if you sign up for a 1-year membership, you get 1 full month at absolutely zero cost. And with the library, you get online access to hundreds of training tools, the references and sources. We have live webinars and CE webinars once a month. We have client support via email. We have a help desk that you can email the help desk, and member discounts on selected KMC University services, like on-site visits. You can pay to have me come into your office for a day or two. We have proactive chart reviews. We do fee analysis. We do all kinds of fun things. And we love working with ChiroTouch. So I'm going to leave that up as well. And then, Michelle, I'd love for you to share your screen so we can kind of like go through and say, how do we make sure that we put all of the correct insurance information? How do we attach a fee schedule? How do we create a fee schedule? If those are any questions that you guys might have.
Yeah, if you haven't taken a a scan of that QR code rather. Go ahead and do so. And Michelle, I'm going to
Turn it over to you.
over to you. We'll go see if there's some questions for us.
Yes.
Okay, so patient insurance. I forgot to, but I did quickly just add a Medicare patient because that actually had a fee schedule.
Yay.
So this patient is a Medicare patient. In their patient information screen in the front desk, right here is where you can attach a fee schedule. So notice I have the Medicare fee schedule attached to this patient. If I go to his insurance tab, you can see he has Medicare. I have his insured ID in. I have his the insurance percent, which is the amount that the insurance covers, right? Typically Medicare is at 80/20. So this tells the software that the insurance is going to cover 80%, charge the patient 20%. Effective date, you can see this patient was created a few years back. And this patient is actually still meeting a deductible. So the effective date does not have to be the actual effective date on their insurance card. This does not go out on the billing. This is just telling ChiroTouch that this is an active insurance policy. Current authorization, this is where you would put the beginning and end date if that is something that you have to do with, I think maybe United might be one of them where they have some policies where you have to get prior authorization. This is where you would put the dates and in the box after of how many visits were approved during that time frame. And then over here in box 23 is where you put that authorization number. Okay. Under insured, other insured's information, typically if they are a Medicare patient, they are the primary insured. So you would just copy patient info, which will populate the information in here. You can see this patient works at Planet Express. You don't want that. You don't want that in there on a Medicare patient or on any regular insurance patient unless they are a work comp. So keep in mind, if under the patient information, you are populating their employer information, that when you go into their insurance, insured, other insured, and you copy that patient info, that is going to pull in. You just need to delete it out. Once it's deleted out, it stays out unless you hit copy patient info again. Make sense? As far as the ledger goes, because this patient still owed on a deductible, it charged the patient $30.10, which is what I have in my fee schedule as the allowed amount. Please do not go changing your allowed amounts to $30.10. This was me winging it when I created my fee schedule a few years ago. So if the patient already met their deductible and I added the charges and I go back to his ledger, oh, I didn't add a charge on him. I'm sorry. My bad. I'm sorry, people. Hold on. There we go. There's the $6.02. So that is 20% of the $30.10.
One other quick thing, I just didn't know if anybody noticed, but in Michelle's, under the insurance tab, under insured, other insured, did anybody catch that box 11 for Medicare needs to have what in it? Does anybody remember? None, in all caps, in box 11 for Medicare. Perfect. And some of the things that I love about ChiroTouch is when we set up those fee schedules, for Medicare especially, we can have it so it has the 98940 with the AT modifier. And if they sign the ABN, they go on maintenance and they sign the ABN, we can also have the 98, you know, the 1 to 2 region with the GA modifier that we got the ABN. It just makes it so seamless for us to be able to do that. Having the fee schedules is just wonderful, and it makes our ledgers so clean. Instead of having the full office charge in there, we know that what's allowed, and just being able to write that off the top just really lets the doctor and the clinic know what's outstanding.
And I did forget to point that out, that it did automatically attach my AT modifier because it is on my fee schedule. To show you where to go to create your fee schedules, you go to ChiroTouch Maintenance from your launcher. You go into Charges, and then you go to Fee Schedules on the top left. If you're creating a new fee schedule, you're just going to click New. You're going to name it. You're going to hit OK. What that does is it pulls in every single charge in your system, every single CPT code, and it puts the full charge amount in the amount and allowed columns. So it puts the same amount in both columns. Let me go down to my Medicare. I added in my AT modifier under the M1 column. Okay, M1 is for the first modifier. M2 is for the second, third, or fourth modifier. You shouldn't ever need 4, but it's there. Typically it's 1 or 2 that you need. You might need a GPGY or GYGP. So the first modifier always goes in M1, and then the second goes in M2. Okay, and then you just manually come in and you change your allowed amounts to what they should be or what they are, right, for that insurance.
So hey, yeah, that's pretty cool. And there were some questions about, hey, can you please show us how to create a fee schedule? So thanks for doing that. Hey, there's one popular question here, Rebecca, that seems to be coming up. And it's more of a curiosity question, I'm sure, but what's the purpose of the word none in that box 11, and why must it be there? Some people say they've never ever put it there and haven't run into any problems. So,
well, I can't say why they didn't know any problems. They just haven't got to that edit yet. It's just that's what Medicare wants. That is what your MAC wants, your Medicare Administrative Contractor, in box 11. So that's great. If you haven't received any denials on that, if you could just get in the habit of doing it, because if you find your medical review policy for Medicare, it will tell you that box 11 needs to have none in there.
awesome. So if it's okay with you, Michelle and Rebecca, we do have a lot of questions. I think we can get through them all. We can just do like a speed round on the rest of the questions here.
Sounds great.
Sounds good.
So Michelle, who updates the fee schedules in ChiroTouch? That's Debbie asks that question.
Whoever in the clinic you assign it to. They don't automatically get updated.
Yeah, it's one of those things that they don't.
In my clinic,
have to stay on top of it.
Yeah, in my clinic, when we get an EOB back from an insurance company, especially at the beginning of the year, or usually like July 1st, if I notice that there's a change in the fee schedule, I just go ahead, automatically go into maintenance, go to the fee schedule and update it there.
And one thing on top of that you have to keep in mind is, I really hope you don't do this, but if your clinic does auto salt your charges, you will need to stop auto salting your charges once you update a fee schedule. Manually add the charges in fresh, and then you can turn the auto salt back on. If you do not do it that way, you are going to auto salt the charges the same as they were last time, which would be wrong because you've updated it. So you want to make sure that if you are auto salting your charges, you turn it off. get those charges added fresh in all those patients, and then you can turn it back on. But in reality, as much as I think it's a great feature, I'm against it when it comes to billing insurance because of the fee schedules. Not everybody wants to turn it off, and they don't always make sure that they get everybody updated.
All right, so let's see here. Debbie asked, does the billing company have their own access to insurance verifications, or do they need to go through us, i.e. the clinic, to get connected to take this role over? I'm guessing maybe she's talking about CT ProBill?
Or CT Verify.
Or CT Verify, yeah. And the way that works with CT Verify is it's all automated. You know, you send over an order, for lack of a better term, from your software directly out of the software with regards to what types of codes you want to know, and as much as how much they're covered or if they're covered, and that note kind of goes through TriZetto and gathers that information, which is readily available online and whatnot, and then delivers that information right back into the software for you. So that's how the CT Verify service works. I'm not sure about the billing company. If it's us as the billing company, we're doing. I'm not sure if we do the verification. Do you know, Michelle?
I don't know. My guess is no, but I am not 100% sure because
I would guess no as well.
Yeah, because that information should be entered prior to them even getting in to do any billing.
Yeah. So, but that's a great question. Then we get over to Brandy, who says, I think maybe this is for you, Rebecca. Is there a way to tell from patients' insurance cards, specifically Medicare, what insurance is primary and what is secondary if they have more than one payer?
That is an awesome question. So unfortunately, the best way to verify that is hopefully you have access to your MAC portal, which is your Medicare Administrative Contractor. So I am in Maine, so my MAC is NGS. So I verify every Medicare patient through the Medicare portal, and it will show me all of the information that I need. It will show me whether Medicare is primary, whether the patient actually has a Medicare Advantage plan, if they are traditional Medicare, if they have a crossover, and then of course, if they're a QMB patient, which is that qualified Medicare beneficiary where they have Medicare as primary and Medicaid as a secondary.
Yeah.
So I hope I answered that question. So really just making sure you can get into your MAC portal.
Hey, Rebecca, how much is an annual membership to KMC University?
I have no idea.
Sorry,
that would
Philippa.
be a hard question.
Yeah. Does it vary as far as you know?
No, I think no. Well, I know that there's like a month-to-month fee, and then if you sign up annually, it's another fee.
Yeah. Okay.
So
and then
just reach out to that 855-832-6562, and they'll be able to help you with that.
And then I'm just kind of revisiting a question from earlier. We assumed it was CA, but no, it was actually VA. Can it be HIPAA compliant to have a virtual assistant complete in verifications?
I would hope that you have a.
And I'm assuming that's automated in some way.
Right.
Yeah.
You would have a code of conduct already. If they're verifying your coverage, they must have access to your database. So I think that would be. I mean, as long as there's HIPAA training and all of that, you've gone through the OIG process with them, then I don't see why it would be any issue.
As long as they're doing it just exactly perfectly, the way it should be done.
Exactly. If they do it perfectly, there's no issues.
Let's see. The folks over at Emeryville Chiropractic say in California, American Specialty, I always fumble over that term because I can't stand them. No
just
offense
call them
to anybody. Yeah. Yeah. I don't want to go there either. In California, American Specialty Health pays $27 Blue Cross, no more than $25. So what is the point of hiring billers as insurance pay what they pay and nothing more?
Well, if you're in network, so my only thought is if you're in network with ASH or Blue Cross Blue Shield, then you are contracted to submit those claims. If you're out of network, then you may or may not have to submit those claims, but you would need to find out what the medical review policy is and what, if you are in network, what your contract states.
So this is probably better geared towards you, Michelle. Debbie asks, do we enter? Wait, hold on a minute here. I lost it. Hold on, I'm so sorry.
Do we enter the basic Medicare card and the supplemental card into ChiroTouch?
Yes, there you go. It scrolled up one notch and I couldn't get it. Sorry.
I slid down to it. So 2 different insurances, correct? Or the yeah, because the supplemental is after the fact, correct? Am I right?
Yes.
Yeah, supplemental is
you're
kind of the
100%
secondary.
right.
Yeah. So Medicare, you would get added in first as that's the primary. Then you would come over to add and you would put in whatever the secondary is. But you would add that secondary in, and then you're going to put the information you need to put in, i.e. insured date, effective date, insured, other insured information, right? Make sure if you're billing EDI, your batch electronic and EDI claim boxes under options here are checked. Now that I did that, when we go back into the insured, other insureds information, you don't see all of those other boxes. But you would just copy the patient info over again. So primary is the first one, secondary is the second tab.
We're going to stay on you, Michelle. On your front desk screen, there was extra information on the side. How do you have that show up?
This?
I think it was when you were, well, it might be this, but I think it was when you're actually on your front desk screen. It's likely the patient card.
This.
Yeah, I'm guessing.
That's in settings, right? I don't
Yeah.
even remember anymore. Yeah, show patient card. Where is it?
Right down. Yeah,
right there.
there you go. Yep.
So it's, let me do that again.
Yeah, turn it off. There you go. I don't mean to order you around. Turn it off, gosh darn it.
You're bossy today. So if your screen looks like this and you want that patient card, you come to the little cogwheel, which is the settings up at the top right. And then right down here, you click show patient card. You can also select name format. So you can do last name first or first then last. And then when you hit close, that's what brings all of this. So it's like a snippet of their account. It gives you their demographics, the provider they're seeing, their balances, their first and last visit. Dr. Farnsworth has been a bad patient. And then you can see their ledger down here at the bottom as well.
Right. I think this goes back to one of those boxes on the insurance setup screen, but the above reference number box is original. What is the difference? It'll make more sense when we see the actual box, I think. The original reference number probably.
This is for Medicaid.
Yeah.
These 2 box 22s are for Medicaid. I guess I should have pointed that out as well.
And obviously this Medicaid resubmission number, right, would probably be different from the original reference number that they gave you, and that's why.
Correct.
Yeah. I took that one off your plate for you. I hope you didn't mind. Amy says, why do we need to delete the employer name except for work comp on insured info? I've never had an issue with it. Maybe that's for you, Rebecca.
Yeah, Rebecca.
Yeah, Rebecca. I mean, I think for group insurance or commercial insurance, I don't necessarily think it's that big of a deal, especially with electronic claim submission. If we put the employer information and the insurance is actually through the spouse, it might get confusing for the insurance company. If we can make it as less confusing for them as possible is always the great thing. With Medicare, we always want to be cautious because if they're working, it might trigger, like, are they, you know what I mean? So just really making sure that any information is there is important to an insurance company if they need it. And that's another thing with ChiroTouch is the little red squares. It tells you which box in the HCFA it populates.
Yeah. So, I don't know this offhand. Michelle, maybe you know. What's the cost to utilize the CT verification service? I,
I don't
I think it's
know.
I think it's right. I think the price point's right around $20 a month per doctor, whoever you're utilizing it for in the clinic. I think it's right around there, give or take.
I know it's not too
$20.
expensive. I just don't know the exact dollar amount.
No, it's really reasonable. I think it's right around a $20 price point, give or take $3 or $4. But I'll tell you what, we can definitely have somebody on our end go ahead and reach back out to you and give you those numbers for sure afterwards. There'll be a survey that comes out once we close the session down, and if you just express interest on that survey, and I think there'll be a question on that survey that says, "Hey, are you interested in this service or that service?" And if you indicate CT verification, someone will be able to reach out to you and answer any and all questions you have with regards to that, Laura.
There's another question about verification, about how do you find the deductible left amount during
Yeah.
verification. So if you're using the ChiroTouch's verification, which unfortunately, since we don't have real patients, I can't even pull it up. But on the form, it will tell you when you view it, what their deductible is and how much is remaining. One thing you have to keep in mind is it can change in a minute. Because the patient may have been seen somewhere else and their charges are going through somewhere else, right? So their deductible's also getting met somewhere else. So do know that it can change, but it will show you on the verification form.
And of course, if you don't have CT Verify, you could always call the number on the back of the insurance card, and probably they have an IVR, where they would be able to tell you how much deductible is left as well.
Hey, Rebecca, with regards to all of these questions, or most of the ones pertaining to what you would handle over at KMC University, is all of this information found and accessible to a member of the KMC University?
Yeah, absolutely. We have so much information on the KMC University library. And the good news is if you can't find it, we have that help desk that you can reach out to the help desk and we can point you to where that information is.
Great question, Lexi. Signia says, hey, we know therapy codes are not covered by Medicare, but if we charge member cash rates, do we calculate 80% of them or up to us?
So we don't want to have a dual fee schedule. So your therapy codes should be one price, regardless of insurance.
Yeah.
So since Medicare doesn't cover it, the question ultimately, the patient should only pay 20% then?
No, the patient pays 100%.
Pay the full, right. So in cases like that is where you might want to, just to make your lives easier, if there's specific codes that you'll use on both Medicare patients and other patients, have a patient type charge created where it won't calculate the insurance amount. And to kind of show you, if you go into maintenance and charges, let me use one that actually has a price. So like this elder root cough suppressant, let's just pretend that that's some kind of therapy that we know that we're going to put on Medicare patients, but we don't want it to only charge them the 20%. You would just make sure when you add the charge, it defaults to service, right? Whenever you add a charge, hold on. It defaults to service here. You would just switch it to patient. Now, again, you can't have a different price. So you're going to put that full price of whatever you bill to other insurances, right? but make it a patient type charge so that it does not get charged that 20%. That 100% rate gets charged to the patient, and that charge will not bill.
Laura asked the question before, but she was pulled away by business in the office. Can you just show her how to toggle on and off the patient card again?
I can. Okay, so to turn the patient card on and off, you have to be on the main front desk screen. You're going to click the little cogwheel for the settings, and then it's right down here to turn it on or off. So if it's off, it looks like this. And if you turn it on, you can choose if you want last name first or first name first. And then it turns it on.
Okay, in the patient information tab under conditions for Medicare, when you take new x-rays, where do you put in the updated dates? Yeah, it's going to be right there under date of last x-ray. And that'll make sure that anything that needs to be triggered on the claim with reference to that date is triggered accordingly.
There's another one about when a patient has a secondary, do you check the another benefit plan box under insured, other insured? Absolutely.
On both policies.
Yeah. On the primary.
Just the primary?
Yeah, you would only put it on the secondary if there was a tertiary.
Got you. That's why you're so good. Adam says, an accounting trading partner, insurance filing indicator. Why is there no selection for PPO Medicare risk? You know, Adam, it's up to the payers themselves to come up with their claim filing indicators. It's not really assigned by us. There has to be some sort of familiarity with one of these other options that are there, right? Because it is a finite list. I'm going to imagine that either falls under a commercial or one of the other Medicaid or Medicare branches. I wish I knew the answer to that for you. And then we're not going to accept any new questions because unfortunately, we do have to go. But I'm going to try to get through the last 5 or 6 that are here. Patty says, if we are not contracted with an insurance, do we have to perform a write-off? I don't believe you do. I think that's a better question for Rebecca. I certainly don't want to give you billing or coding and advice simply because I'm not a certified biller or coder. But if you're not contracted with any insurance companies, you're your own business, and by golly, you can charge cash prices, and you likely can charge whatever you'd like, if I'm understanding the question correctly. But don't hold me to that. I am not a lawyer, nor do I play one on TV.
And then I think it comes down to if you bill. If you bill, you're accepting their terms. So yes, you would have to write off.
Oh yeah, good point.
Yeah.
Good point.
So that is the best question to go to Rebecca. Unfortunately, she's jumped off because we're over time.
Yeah. But
that would be my belief, just from working with KMC, doing so many webinars, that if you bill an insurance, whether you're in network or out of network, you're accepting their terms.
And so, Amy, your question is going to be something I think that is best left to Rebecca. Just shoot them an email over at KMC University. I'm sure they'll be happy to answer that for you. Laura's question was around how do you enter in the supplemental insurance or the secondary insurance, and then if there's a third insurance, a tertiary, or if there's a Medicare, a secondary, and a supplemental. So it's just adding another tab to that insurance screen, Laura. With that being said, there's a couple of last questions, and we'll get them after this session ends, and we'll either have somebody reach out to you, or if it's ChiroTouch related, I would say, give us a call here in support. We'll do our best to answer the question for you. And if it's coding or billing related, go ahead and send a little note over to KMC University, and they'll be happy to help you guys as well. I'm sorry to end this, but we're a little bit over time. I hope that everybody has an outstanding rest of your day. I hope that everybody pulled something from this session today that helps them back in the office. And by golly, I hope we see you in 2 months for the next KMC ChiroTouch Classic webinar on billing hints and tips. Michelle, have a wonderful day.
You too, and everybody
Okay.
else as well.
Bye now.
Bye-bye.